Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then amoebic liver abscess. Amoebic liver abscess, as the name says, it is caused by entamoeba histolytica. And because it is caused by entamoeba histolytica, the patient gets infection of entamoeba histolytica through a feco-oral route. Then from the feco-oral route, the trophozoites will enter the digestive system, and from there they reach the liver through the portal venous system. So in the portal venous system, they reach the liver and they cause abscess there. So these amoebic liver abscess are also a solitary abscess, and they are more commonly seen in the right lobe of liver than the left lobe of liver. These amoebic liver abscess have low incidence, are in low incidence of invasive amoebic liver abscess is seen in menstruating women. There is low incidence of invasive amoebiasis is seen in menstruating women. So because there is less incidence in menstruating women, so male are more commonly affected, and to young men are more commonly affected than the females. And these young men are more commonly affected than females due to heavy alcohol consumption plays an important role in the pathogenesis of entamoeba histolytica, producing amoebic liver abscess. Then pathogenesis. Most common form of invasive disease in amoebic liver abscess is by colitis. First, it affects colitis more frequently, followed by cecum. Sorry. Colitis is complete colon, right? Even in the colon, it most commonly affects the colon, and in the colon also, it most commonly affects the cecum and the ascending colon. Now, in the colon, you will see that flask-shaped ulcers are seen, and these flask-shaped ulcers are actually most commonly seen on the cecum and ascending colon. These are more commonly seen in the cecum and ascending colon. We have synchronous hepatic abscess. Synchronous hepatic abscess is simultaneous appearance of two abscess are seen in almost one third of the patients with amoebic liver abscess.
thank you and thank you for watching.